Are you looking for relevant healthcare information? Log on to Medicircle and watch experienced medical professionals talking on common healthcare topics. Stay informed, stay healthy, stay tuned to Medicircle.
We at Medicircle are constantly working on bringing to our audience all the trending health related topics. It is our primary objective to bring to your attention news and views you need to be aware of to lead a healthy, disease free life. To help us in this regard, we'd be joined by eminent and expert top doctors from across the country. Today in Doctor Speak, we are going to talk about the problem of arthritis and ways to help you deal with it. Hello, this is Aprajita Mehra, and you are watching Medicircle. Today on our Arthritis Awareness series, we have Dr. Mitesh Valvi with us. Dr. Mitesh Valvi is a renowned orthopedic in Mumbai and currently practices at Ortho Clinic, Borivali West. For the past 10 years, he has worked as an orthopedic doctor and gained proficient skills and knowledge in these segments. He has pursued degree of MBBS and MS Orthopedics from KJ Somaya Medical College and Research Center. He also did his fellowship in joint replacement surgeries from Revival Hospital, Mumbai. Till date, since 2011, he has successfully performed over 3,000 surgeries, including few specialized revision knee and hip replacement surgeries. So it is our privilege and pleasure both to welcome at Medicircle today, Dr. Mitesh Valvi. Hello, sir. How are you today?
Hello. Yeah, I'm doing all good. Thank you.
Fantastic. On the series that we are doing to raise awareness about arthritis, my first question to you would be, Doctor, that how does arthritis affect our daily life?
Okay. So to begin with, I would just give a brief about what exactly arthritis is. Arthritis is a condition where there is inflammation of the joint. It can be one more joint. Most commonly in India, we have joints like the knee and the hip, which are majorly affected. That is because of our lifestyle. And arthritis can be divided into two broad spectrums. Like it can be a primary arthritis or maybe secondary arthritis. Primary arthritis, or you can say osteoarthritis. Basically, osteoarthritis is a degenerative disorder, which means that it is related to the age factor. It is most commonly seen in people of the older age groups, and this is the condition where the joint, basically the articular cartilage. The articular cartilage is the surface which covers our bone. So there is destruction of this joint cartilage, articular cartilage, and that leads to inflammation of this joint. Mm-hmm. So when a person comes to us in their older age group, or they come to us with complaints of having while doing routine activities, they are having pain or maybe swelling in the joints, then they are graded as patients with osteoarthritis. And if there are patients who come to us with some secondary complaints, like if there is not only joint inflammation and swelling, but it is also associated with excruciating pain, then we need to analyze. We need to analyze certain conditions where the joints are also affected, not only the bone, but also the tissue around the joints, that is the synovium, what we call. And you must have heard of this conditions, which normally in layman's word, people might tell you that, sir, हमको संधिवात तो नहीं, या फिर जो संधिवात बोलते for the layman, it is a condition which we call rheumatoid arthritis. So that is one reason for your joint getting worn out. And there are conditions when, like, there is a trauma to the joint, that is like an injury to the joint, and that might lead to your post-traumatic osteoarthritis or post-traumatic arthritis, which is going to completely destroy the joint. And that can happen in any age group. So that is one thing. So now, if you ask me, how does arthritis affect our daily life? People with arthritis, with osteoarthritis or rheumatoid arthritis, they find it very difficult to do their routine activities also. If they need to travel from A to B, they are in pain. They need to, if I ask a patient to climb up the stairs, it would be painful to him. If a patient cannot easily mobilize or easily walk from distance A to distance B. So that is the time when their routines are hampered. They cannot go out for getting their daily needs or go for their shopping for your daily requirements of food and all. So that is the time, and that is the thing which is affected in a patient's life. So connected to it, the patient does not socialize, the patient does not go out, and that can also lead to many psychological conditions. So arthritis is a very serious condition. If not taken care in the early stages, it might lead to all these complications. So we need to tackle this condition very early to get a very good result. Yeah.
Right. Very well said, Doctor, there. Immobility is something which affects not only
Yes.
your physical, power of, doing small, simple chores, but it affects you mentally, emotionally. You get caught up that while
100%.
the whole world is running around them, they are unable to do, unable to do even simple tasks like
Simple
running for
tasks.
work and, doing their household chores. So that naturally
Yes.
affects them. And that's what makes arthritis so, serious problem. So,
Serious
sir,
problem. Yeah.
my next question to you would be, Doctor, is arthritis hereditary?
See, exactly. If you ask me, arthritis is not hereditary, but there are certain conditions which you can say, osteoporotic knee or an osteoporotic bone can lead to osteoarthritis. And if we see osteoporosis is very common, you can say it is one cause which can be put up in the hereditary group. And just because your bones are not healthy or the bones are weak, that might lead to your arthritis. But per se, if you ask me, arthritis is hereditary, I would say no. Even rheumatoid arthritis is, you cannot grade it into a hereditary condition, but it is related to your many genetic compositions, and it falls into an autoimmune condition. So exactly, they are not hereditary conditions, but yes, certain patients are more prone to these conditions in the
Okay,
families.
so it's not a genetic problem. It's not something which
Yeah,
comes in your family.
yeah,
Anyone could
not
have it.
every patient.
Anyone
Yeah,
could
not
develop
every.
this. Okay.
Yeah, 100%. That totally depends on your bone quality, and that totally depends on your lifestyle and your. You can say the if there is, like I told you, if there is a injury which was there in the past, it might resurface and you might get arthritis early. Yeah. So per se, it is not an hereditary condition.
All right. Doctor, which
Yeah.
arthritis causes swelling?
Yeah, see, basically, arthritis is going to cause you swelling in both the subgroups. Let it be osteoarthritis, which I told you is age-related thing, or rheumatoid arthritis, which is a disease which affects the synovium. And both the conditions are going to give you swelling because there is a reactionary inflammation in osteoarthritis. Okay, so even if the tissues are good, the tissues are healthy in osteoarthritis, but just because of the friction which happens at the article level in the knee, and a reaction to the debris which are formed, as we know that knee is a closed compartment and they do not have a place to vent out all the debris which are there, so they settle down around the pockets in the knee, and that leads to a reactive inflammation, and that leads to the swelling in osteoarthritis. In rheumatoid, yes, or any other arthritic conditions, there is inflammation of the synovial tissue, that is the tissues around the joint. Yeah, so swelling is seen both in osteoarthritis, but it is seen more in the severe stages or grade 3 or grade 4 conditions of osteoarthritis. So that is one thing. What
Is there any age for the swelling to come up? Like, do young
uh,
people also get this swelling in arthritis, or is it only an old
yes,
age
yes.
problem?
Sorry. No, young people who are graded to the autoimmune conditions, like I mean, if young patients, rheumatoid patients are always young, okay, and the osteoarthritic patients are all the people who are above and around the age of 50 or 60. But you can see many younger age group people who have this rheumatoid arthritis in the age group of 30 also, they might present to you with a severe swelling and inflammation of the joint. So that is one thing. which is very common.
All right. So, doctor, what are the preventive measures for arthritis that people can take?
Yeah, so if you see, most commonly, as I spoke about, it is osteoarthritis, which is a matter of concern to us because if we talk about the other types of arthritis, they are not completely curable, but we can surely get down the joint inflammation. In osteoarthritis, we can prevent the joint from getting destructed. The articular cartilage, we can surely prevent it and keep it healthy. Now, what can we do to prevent arthritis? Is like the first thing what comes to our mind is lifestyle modification. You need to modify your lifestyle. Once you fall into for a woman above the age of 45, we grade it into a postmenopausal woman. There are hormonal changes which occur in the body, and the body is not able to retain the calcium in the bones, and their bones start getting weaker day by day. So what we need to do is we need to completely modify our lifestyle. We need to start having meals on the dining table. We used to start using the commode. We have to use this lift instead of the stairs. So these are certain modifications which you do it in your life, and you can keep the joint healthy. So these are things what you should apply after a certain age when you know that you have started getting knee pain. Let it be at any age. It is not, there is no compulsion that from 50s only you need to start. If you get the pain at around 45, you can simply modify your lifestyle. Cutting down your weight is a very, very important factor in that. You can surely cut down the problems to 50% if you are not obese. So that is one thing what we need to do. There is one thing which is related to your profession, obviously, or if you are into a profession where you need to do certain repetitive activities. So we need to stop those activities. So that is one thing, and these are simple ways with which you can get prevent your joint. Second thing I would talk about would be a diet. You should have a very good diet, a diet rich in calcium. Uh, I always recommend my patients to have good milk products, green leafy vegetables, dry fruits, and pulses. These are richer sources of calcium, which you can surely get it from your diet, and we need not supplement you with some calcium tablets or something like that. So that is, diet should be very healthy in that case. And if at all the bones are not really very strong, in spite of taking all these measures, then you need to see us orthopedic surgeon, and we would supplement you with the right, bone building agents. Yeah. So that is one thing what we can surely do to prevent arthritis.
Absolutely. Doctor, in
Yeah.
your answer, what I realized was there's a bit of contradiction. Like everybody
Yeah.
is told to, do healthy. We need to switch to lifestyles, which is not,
Yeah.
sedentary. Your video is closer.
Yeah.
Right. So,
Yeah.
which is not,
Yeah.
sedentary, and people are trying to, work out every day. They need to walk, they need to take stairs. And normally, if at
Yeah.
all they have problems, so how
Yeah.
do they maintain their weight, keep themselves agile,
Oh,
have a healthy lifestyle
yeah.
also, and still, avoid doing things that you've
Yeah.
just mentioned?
Yes, yes, yes. See, certain activities, if I tell you to be active, that doesn't mean that you need to, take the stairs in place of the lift. Okay, when a patient comes to me with joint pain, I always tell them, do not stop walking. There is no restriction to walking, but yes, you cannot walk on a surface which is inclined or declined. Okay, basically we need to offload the knee. The problem is the loading on the knee. If you are sitting down on the floor and if you get up, there is a lot
Uh-huh.
of loading on the knee, and that leads to
Right.
articular dysfunction. Yeah, if you are
Okay.
walking on an inclined surface, you must have seen many people in the gym using the treadmill. If you are walking on a neutral surface, no problem. But when you go inclined, they are causing some pressure on the joints also. So if your bones are not good, if your bones are not healthy, and you are having this pain, then the orthopedic surgeon would never advise you to walk or climb the stairs. He would always say that you walk on a flat surface, no matter how much ever time you want to, say half an hour, 45 minutes, but on a flat surface, you can surely take the walks. So that is what I meant by keeping the activity good. And yes, you can cut down the weight by simple walking and your diet. So That is
All right.
the
Okay.
concern for me.
Yeah, I get
Basically
that.
offloading of them.
Because this
Yeah.
might, this is a question which might have come into any of our, listeners and, audience which is
Yeah.
watching us now, would be
Yes.
definitely,
Yes.
wanting to ask this, ki if at all is walking and all these exercises are safe or not for the people who are having joint
It's
pains.
even, yeah, even if you ask me for exercises, I would recommend you to a physiotherapist. Okay, a physiotherapist are doctors specialized in strengthening the muscles and the joints. So what they do is they would strengthen your muscles around the joint, which indirectly or directly they are going to support and give stability to your joint. Okay, once your muscles are strong enough, the process of degeneration is not going to halt, but obviously the joint is going to be stable. You are going to get pain free, and that is the entire motto. That even if
Right.
I do a knee surgery, my
Mhm.
primary aim is to give a pain free joint to the patient. So that is the thing. So we can surely cut down the pain on a very good scale if we do this exercises, physiotherapy in the form of physiotherapy.
Okay. Thank you so much for coming on our show and sharing your valuable time and insights with us here at Medicircle. It was really a pleasure having you today, Doctor, and you've been very informative. Believe me, this is really going to help our audience a lot in ways to deal with arthritis. So thank you so much again. Thank you.
Thank you. Thanks a lot.